what I will try to do is go one step more into how we could solve such problems as the one described before, based on the experience that IHE has gathered the last almost 15 years now, working with the European Commission on cross-border healthcare. So trying to support all the technical aspects of the cross-border settings up to today, which are the, let's say, the electronic exchange format is a continuation of all that. So trying to see a little bit what are the challenges that we are trying to face. Well, we all know that, and I think Terje was very descriptive in her approach, that all the healthcare providers and the decision makers and the policy makers, they are faced with quite a lot of challenges during those years, and COVID was just one of them, which means that most of healthcare systems, they need some type of be able to cope efficiently and efficiently in the next, let's say, 20, 40, 50 years, depending on what are the investment that someone can make. So we have a lot of challenges, and probably the support of health information exchange and common models like the European Exchange Format could provide some support to the member states in trying to advance in a collaborative way and try not to invent the wheel for everything that they have to do. So in general, what we see around Europe, but not only, is during this period of time, most regions or governments or who is really responsible for healthcare, they are usually focusing on two things. One is try to implement electronic health records, like shared records, or something like a national or regional strategy to be able to exchange information which are mostly targeted to exchange those information for the purpose of delivery of care, so it's between clinicians. But we are now gradually advancing in trying to move towards care coordination, which means that in this case, the patient has an important role, and that's something that it seems that it's more and more adopted by different strategies, where we will go towards a domain where everything will be somehow connected. We all see, we all saw that in COVID, a lot of things were moved to electronic services because there was no possibility to do this otherwise. And now we are advancing. I think most member states have new strategies about evolving in that domain, each one taking it from a different perspective. So in all this, IHE has been supporting the European Commission since the EPSOS times, where it created an entity called IHE Services, which now has been converted into a separate entity to be able to support all the stakeholders in the domain of healthcare information exchange, which is now called IHE Catalyst, but in fact it's just a spin-off of IHE Europe. The idea is to be able to provide support in whatever stage of implementing a healthcare information exchange strategy or a roadmap, meaning, in other words, talking about interoperability. And in that sense, there is an important part where we need to address is the preparation of all the stakeholders, so that from the side of the users, they can accommodate very well their demands and their needs. And on the other side, those that will implement those requirements, they need to understand exactly what those are, so the vendor community. So we have been working all those years into bringing those two communities together and try to solve the equation of interoperability, which at the end of the day, it's all about teamwork. So what we want to say by that is that usually the technical problems, they are solved quite easily. The problem is how do we find the right methodologies and governance to advance them step by step. And the approach that seems to work is to try to create reuse of core standards, but try to create the interoperability scenarios based on use cases, so that we don't have to deal with one monolithic way and try to solve all the problems at once. The next step in this is to be able to test those specifications and those use cases before they're put into production. And that's a model that has been adopted by the European Commission for the MyHealth EU services. And they have their own, let's say, testing strategy, and so that they can support the member states into evolving their systems and connect them for the use cases that we have for the moment. So this leads us to an important part, and an important part related to the success of such, let's say, digital transformation, is to not create unexpected surprises neither to the user community, neither to the vendor community, which means that normally we should try to adopt those specifications in a co-creation mode, try to test them and gradually implement them. And that's a model that has been used in several places, and it seems to, at least for the use cases that have been selected, it seems to work. Now, if you have read the new proposed regulation, there is a big part, maybe a whole chapter related to electronic health records, the specification there, and how those be somehow certified at some point of time. So the issue that we face here is that if you go to the vendor community, they are already confronted with several, let's say, certification issues that they have to face, like cybersecurity, like medical device regulation, and other things, which means that we need to find a way to organize things so that also we can somehow contain the costs of changing those type of systems and softwares that will implement those strategies, and maybe, hopefully, reduce also the costs that Terje mentioned in her own presentation at some point of time. So that's maybe if we create this European market, we will able to have better competition and also reduce prices for all of us. So in that process, if we want to move towards certification, we need to start by testing so that people are educated. The next step is, at least by, if you follow ISO terminology, is to try to perform conformity assessments, and then the reports coming from that conformity assessment would be used for certification programs. So this is a model that has been adopted by the European Commission since the times of EPSOS, and you see the architecture of the EHDS, and all those components are being constantly tested twice per year in the testing strategy implemented by DG Santé and the EHDS application provider. Now, with the new regulation that is under discussion, we are going to go one step further. I won't go into details of that one. I guess there are other sessions that will talk in more detail, but one of the amazing points that have been adopted, are proposed for adoption, is the concept of certification of electronic healthcare record systems. And maybe the first step to move is to start from the specification already created initially by the EHRs project. So we already have most of the specifications included in the electronic exchange format already in a predefined format, at least in two standards, PDA and FHIR, which means that we don't have to start from scratch. The only thing that we have to do, of course, is to try to see how those specifications could be adopted by member states. That's just a snapshot of the strategy that is used for EHDS, and probably a similar one could be adopted in that case. As said, we have been supporting this community of people since 2011, where we made the first gathering and testing event, and we have not stopped supporting and performing testing events until today. So already almost 12 years of supporting with evolving specifications as we move. For this, we use open source tools. There is a set of tools we call Gazelle, which are more or less a combination of pre-existing tools that can be modeled to solve specific use cases. So we can aggregate specifications and create test tools and test plans so that those can be tested. As I said, all this is about people. So at the end of the day, all those tools are used to bring people closer, to be able to perform those tests that will resolve problems, reduce costs, and increase sustainability of systems that are connected. Now, those tools, usually they are used in several ways. What we see as a very good model is the one that is used by Switzerland, which they have two versions of the tool, one which they use in testing events similar to the one organized by the European Commission. They call projectathons, And they have a version which is a free version every year, which is a certification set of testing tools, which they give to the different labs that are certifying the electronic healthcare systems in Switzerland, and it seems to be working. Projectathons are being created all over the world with our support in Latin America, in Canada, with WHO, in Switzerland, the European Commission, and many other places. Now, the good thing about tooling is that you can check, obviously, the quality of the information exchange, but you can also test the quality of the documents that you want to exchange. And this is just an example of the quality checks we are doing with a technology called model-based validation, where we can also see the business rules included in a clinical document, if the document is well formed and the clinical information is correct, not only the technical part of a document that is being exchanged. Now, trying to close, moving towards the concept of certification, the European Commission has been working on these concepts for quite a long time. There were 3 projects across time, HITCH, Antelope, and EUROCAS, that advanced the concepts there and try to aggregate and reuse different terms and projects that have been created in the meanwhile, like the refining health interoperability framework. And now we have the proposed new regulation for the European health data space. All this is related, and probably at least our proposal is to start working on the results of the EUROCAS program project, which was funded by the Commission, and try to create, based on the European exchange format, conformity assessment scheme that can be adopted by all member states. And then each vendor could test their systems in their home country, whatever that is, and be automatically recognized in the other member states. This would enable us to create a European marketplace that will try to meet the needs of all the stakeholders within that market of digital healthcare. So with this, I would like to thank you and try not to miss our next EHE Connectathon week, which will be the 25th to 29th of September in France, in Rennes. A lot of interesting things will happen there. We could also see how testing is being done between vendors in Europe, partially based on European specifications as well. Thank you very much.